So just to kind of kick us off, Jules, kind of the last thing you mentioned in your video, when you were talking about different ways that people could get involved, what, if people are clinicians in particular and they are regularly interacting with patients, they could encourage their patients to participate in GenomeConnect. Do you have any materials or anything like that that people could use to make that process easier?
I certainly do. So I'm going to share my screen, but first I will say that we did include one material in the resources for today along with this session. So we have a flyer about GenomeConnect that's available on our website, and then also an attachment to today's session that looks a little bit like this. And it just outlines really the main points of participation in GenomeConnect, how to enroll, and then some of those benefits that we walked through today. So this is available for download on the website and is something that you certainly can use if you're interested in informing patients about the opportunity to enroll in the registry.
Perfect. So people could print that out and hand it to their patients as a way to kind of just get them the information.
Exactly. And on the website on ClinGen, and I know you've seen this website in lots of other ways over the past couple of days, but we do have a documents tab under the GenomeConnect portion that includes that flyer. If you want to take a look at the health survey, our consent, some other documents that we often get asked about are also there.
All right. Now a question coming in from Deb in the chat. So what about if someone has a research result, not a clinical result? How does GenomeConnect handle that? Do we handle that? What do we do?
Yeah, so Erin, some of these discussions we've had. We typically submit variants that have been confirmed in a CLIA environment. So that could be a CLIA research lab or a clinical laboratory. So we try to make sure that we're confident in that variant call when we submit it to ClinVar. With that said, we do engage anyone who's had genetic testing in the registry. So folks are still more than welcome to enroll, share their data. We collect it within the registry, but we might not put it out there in ClinVar in the same way if it hasn't been confirmed, just because we don't know if it's just an artifact of the platform and might not truly be a variant that was identified in them.
Right, or might not belong to that person. You did mention CLIA lab, and that is something that is unique to the United States.
Yes.
But that's just a process. There's certain procedures that need to be in place to make sure that chain of custody was followed. We know the person that we think we're testing is the person that's being tested. The variant is technically valid, things like that we may not be doing in a research setting.
And for international labs, what our team has done, Erin included, is we'll take a look at that report sort of carefully and see, do we feel like this variant is truly in that person? Does it seem like the sample was collected in a way that we can trust that variant? Because we'd hate to put information out there that isn't accurate or doesn't accurately reflect variants that were identified in that person. So we include that in our review of those reports as well.
Now, I know that, sharing of our participants' variants in ClinVar is a big part of what we do. But can you speak to, do we do anything to try to avoid having duplicate variants in ClinVar between the submitting lab and GenomeConnect?
Yeah, so a couple pieces there. I think we certainly will still submit a variant even if the submitting lab has already submitted it. As you can see from some of the cases that we walked through, we're often adding additional details above and beyond what labs often share. So there is utility in getting it out there, even if it already has been shared by the reporting institution. But the way that we submit it to ClinVar highlights that it's coming from a patient registry, that the reporting lab might also have submitted it, and we include the reporting lab in our submission so that folks who are using ClinVar can see, oh, GeneDx submitted this as well as GenomeConnect. And then in terms of working with multiple registries, yes, we do have ways that we're trying to reduce, if people have enrolled in multiple places, any duplicates in that way.
Jules, the testing lab, is that still kind of hidden on ClinVar, or is it easy to find out? And if not, would you want to just show people really quickly where they can find that information if they're not sure?
Okay. So I walked through this in the slides, but I think it's always good to show it again and just talk through it a couple of times. So the reporting laboratory can be found in a couple of ways. Our structured submission for the reporting lab is sort of buried under evidence details here. If you click on that, you'll see the laboratory's name. But what we've done to try to bring that to the forefront and make sure people can see it is we do include the genetic testing registry ID. So that's an ID number for laboratories who have registered with the GTR. If they don't have a GTR ID, we just use their name here. But again, to just make sure that it's on the main page so you can see. In this particular example, we're the only submission, but in others, you would see those other submissions listed there and then can work to see if the reporting lab is also shared.
Okay, and Jules, you are on mute just so that you might have just done that.
I did, because I have a little pup here who's apparently—
Oh, dog. All right, another question coming through the chat. If somebody joins a patient registry for a disease group, like maybe one of the other Invitae-PIN registries, for example, are they automatically entered into GenomeConnect, or do they need to do a separate process to get into there?
That's a good question. So for any external registry that we're working with, whether it's on the same platform as GenomeConnect or on a separate platform, it isn't automatic. So we work with that registry to explore if they're interested in data sharing broadly. If they are, we work with them to explore if an additional consent is needed to make sure that we have access to the details to be able to share it. So there are some additional steps that are needed for those external registries. We don't automatically share without getting people's permission to do so and those sorts of things.
Then can you tell us a little bit about how GenomeConnect kind of fits into all of the other pieces of ClinGen that we've kind of heard about over the past 3 days? Like, you know, how can this information be used within either our GSEPs or our VSEPs to help with our curation activities?
Yeah, so we see the information that's being shared by patients as being something that can be used to inform those efforts. So for GSEPs, if you have a gene that maybe there's only one publication with a handful of cases, the details from a GenomeConnect participant could be useful. They might not have been included in that publication or were unlikely to have been, and could help further understand that gene disease relationship. And then for the VSEPs who are focused on specific variant creation areas, same thing. The details that we have from GenomeConnect participants also could be used to inform variant classification. Also, because we have the ability to recontact people over time, if additional details would be helpful. I'm thinking about if some of the metabolic groups that are doing variant curation, if things like biochemical testing results could be helpful, we could always reach out to those folks to try and get those details to help move the needle on some of those classifications where we can.
It kind of goes both ways, right? I mean, we've definitely had scenarios where the patient needed the help of ClinGen to kind of move a candidate gene into an established gene. Do you recall that anecdote where you had to reach out to the ID Autism GSEP to curate a gene specifically for a GenomeConnect patient? Do you want to share that story if you recall it?
I don't remember the exact gene, but you're right that it's a two-way street, that these participants are providing details, but we also try to share our learning back with them. So we might, if a VSEP curates a gene and updates the classification, that's information we could provide back to patients, that if it was a VUS on their report, but our expert panel is now saying it's benign, that's something that we can feed back to them. Same with candidate genes, as you alluded to, Erin. This has occurred where a patient has a candidate gene. We know it's in the queue for ID Autism to look at. So we say, hey, can you bump that up a little bit? Look at this a little bit faster. Has this been updated because we have this GenomeConnect participant that it could result in an update to their results in their care. So yes, that two-way street is important. Patients can inform ClinGen's work, but then also ClinGen's work can circle back to those patients and help them get updated information as well.
Yeah. And segue into the last question that I'll ask you, it kind of gets back to the issue of the two-way street, but with the VSEPs. But why don't we report back to patients when there is a conflict between their lab and another lab? And kind of what do we do instead in those instances?
Yeah, I think as Heidi Ream and Stephen Harrison, I think, talked about yesterday, whenever we look at a ClinVar record, if there are conflicting interpretations, classifications, it's hard for us to know who's right just by looking at that page. But we do have other efforts within ClinGen to try and reduce those discrepancies and come to a conclusion about those variants. So if we have a GenomeConnect participant where we note that there are multiple submitters, they don't seem to agree on classification, we have been trying to feed those into that discrepancy resolution group to try and come to a consensus. And then once we do reach a consensus, or if things have shifted, we contact our GenomeConnect participant as appropriate. As the registry, we don't reinterpret things, but we try to use the other infrastructure and work within ClinGen to reduce discrepancies, update classifications where we can, and feed that back again to our participants.
All right, well, we're getting a message from Danielle that we have reached the end of our time. I hope that everyone kind of walks away from at least this breakout session realizing that patients can be a vital part of this data sharing process. And we at ClinGen would love to involve your patients if that's something that you're interested in. Or if you would like to create your own registries or things like that, we are happy to provide advice or guidance about how to get their data shared publicly, if that's something that you're interested in. I think Jules' contact information is in the slides. The slides are available on the website. And with that, we will let you go. Enjoy your weekend. Fill out that evaluation survey, and we hope to work with you guys soon.